First Minister, the BMA has told us today there's huge disparity in staff accessing the vaccine in different health boards. Why is that?
Well, different health boards are making their plans for vaccinating both frontline staff, care home staff and people aged over 80. And there are different combinations depending on where you are in Wales. But actually more vaccination in Wales has taken place amongst frontline NHS staff than any other group. And that is because of the importance of helping those people to be in work at a time when the NHS is under very real strain.
But doctors are telling us there needs to be more transparency and communication around delivery for healthcare professionals and for the general public.
Well, I think they need to talk to their health boards because those will be the people who can set out those plans for them. For the general public, we have said since the very start, we are following the priority advice of the Joint Committee on Vaccination, as is every other part of the United Kingdom. And vaccination in Wales is going ahead every bit as quickly as any other part of the UK.
There's a feeling in North Wales that people there aren't being vaccinated at the same rate as people in the south.
I honestly think that is nonsense. North Wales has its fair share, as every other part of Wales has. We have battled and battled with the Conservative Party here in Wales to get North Wales the protection that it needs. They've done their very best to undermine our plans to do that. Now they want to raise, I think, an entirely spurious complaint that North Wales isn't getting its fair share. It is, and it will.
The Care Home Forum in Wales have told us today that this new strain is rampant in care homes. It's now a race against time with the new vaccine.
Well, that is certainly true. It is a race between infection and injection, as they say. And vaccine is not going to come to our rescue in Wales over the short term. The next few weeks are going to be very challenging weeks indeed in our NHS, and the difference we can make will not be vaccination, it will be the actions that each one of us takes in our own lives. Coronavirus is not over. Doing all the right things, social distancing, washing our hands, not putting ourselves at risk, those are the things that will make a difference here in Wales, and it's really important that we all stick with it. That way we get through the difficult month of January, and then vaccination will begin to make a real difference.
The new vaccine obviously giving people hope, but it's about managing people's expectations.
Well, there are 3 million people in Wales, and we will need to vaccinate a very large number of us, and that's not going to happen quickly. So people, I'm afraid, will have to be patient. People will need to know that we are providing the vaccine in the places and to the people where the need is most urgent. And some of us will have to wait a little longer. But with a new vaccine, which is easier to use, easier to transport, capable of being delivered in GP surgeries, for example, we will be able to make that difference more quickly than we would have been without it. And that does give us that glimmer of hope for 2021.
Teachers are on the front line. Where are they in order of priority for vaccination?
Well, of course I understand why any group would wish to make the case for themselves to be put at the front of the queue. But if you do that, somebody else will be pushed further back in the queue. We take the advice of the Joint Committee on Vaccination, the most expert group in the whole of the United Kingdom. If their advice were to change and they were to tell us that teachers should be put to the front of the queue, that is what we would do. That is not their advice at the moment.
Should schools be going back next week?
Well, we are having a phased and flexible restart of education here in Wales. This is what we did back in September, and it was done very successfully
The
there.
picture's changed, the rates are going up. Is it still the right approach?
Well, the rates are going down in Wales, I'm very pleased to say, and have been for the last 5 days. But offering flexibility to local education authorities and to head teachers means that the first couple of weeks of the new school term, adjustments can be made to take account of local circumstances. I think it is better to rely on people who are there at the very front line to use that flexibility rather than trying to think that from the building behind us we can make a rule that applies in every single school in every single part of Wales.
New Year's Eve is coming up. Does that worry you in terms of compliance?
It does. It's very important to say to people in Wales, the rules in Wales are very clear. You must stay at home. It is not an excuse for doing things that put yourself and others at risk. The position in our health service remains very serious in Wales today. Nobody, but nobody should think that they are beyond the rules and can take risks that add to the pressures that the health service is facing.
We're poised to start a new year. This vaccine gives us a little bit of hope.
Oh, the vaccine does give us hope. 2021 will, I hope, be a different year to 2020. It will take some time before the vaccine begins to make the difference in all our lives that we want to see. But without it, we will be facing another 12 months of the sort we've just all endured. Next year can be different, will be different. We've all got to work together to take the maximum advantage of those opportunities.
First Minister, thank you. Diolch.
Thank you.